You have the sulcus on one side and the apex on the left side. You are correctly identifying the anterior surface of the heart. And you will see a C-shaped structure going like my finger, going from right to left. This has to be the pulmonary trunk. Okay? Now, since this is the anterior surface, and remember, anterior surface of the heart has what? Has the arteries. Posterior surface has the veins. We know the difference between artery and vein structure. Why? This is strong. This is rubber band. This is a thick wall that maintains its shape. Okay? Whereas these are flat, smushed, squished. Okay? The wall is very, very small. Here is the wall of the biggest vein of the body, which is the superior vena cava. You see what I have my probe? Okay? This is the superior vena cava. You see how thin the vein is? Yes? You see? Compared to this? Yes? Makes sense? So remember, if you make a boo-boo in identifying the anterior surface, you look at the other interventricular sulcus and the apex. And here is the other interventricular sulcus, but the apex is where? Is right underneath. Okay? Or maybe to the right. Could not be the anterior surface of the heart. Alright? So here's the posterior surface. Yes? See how it's right underneath? But look at this. See where it's going towards the left? Yes? This is the sulcus. This is the apex right there. This is the normal position of the heart. Got it? So if this is the anterior surface, I'm going to do it anatomical so everybody can follow with me. This has to be the left auricle. This has to be the right auricle. What is an auricle? The ear. What's the importance of it? Right underneath is the one and only atrium, or the superior surfaces of the heart. Okay? Now we can see here the anterior structures, which must be arteries. Remember, artery away from the heart. Okay? Vein versus the heart. You see all the veins coming from the back? See how squished they are and flat they are? And here's one of them. Alright? So, you have the anterior surface of the heart. So when we get to anterior surface, now we know that this is the left ventricle, this is the right ventricle from the outside. Okay? We want to confirm this. We're going to make a cut here. So when you get to your hearts, you are going to identify this, almost an inch next to it. Okay? You are going to make a cut deep enough. You don't have to reach the apex, but you can. It's not a problem. Okay? And you open the heart like so. And this is what you are going to see. You are going to see the papillary muscles and outbudding from the inside of the heart attached to strings. And those strings on the left hand side are attached to two leaflets, which is or are the leaflets of the mitral valve. There's one and there's the other. Okay? So these are the mitral valve leaflets. Alrighty? Now if we are in the left ventricle, okay, we want to make sure to make use of this landmark, which is what? Which is the left atrium, left auricle. You go to the left auricle, and you go down, you are going from the atrium to the ventricle via the mitral valve, and it's right there, the whole thing. Okay? You're still in the left atrium. You are going to put your finger out, and they come out from the pulmonary veins. Remember, versus the heart? Veins, they get oxygenated blood from the lungs, and you can see there's several one of them here. Technically, they are 4 in number. Okay, 4 pulmonary veins, and they're cut in different directions, so you might not see them very well. Okay, but here's the deal: in your heart, you're going to make a cross here with the scalpel, and then make an opening here. You come out from the veins of the heart. Okay, pulmonary veins. All right. You go back to the same side. You are into the between atrium and ventricle. All righty. Okay. And if you look closer, if you look through the atrium, okay, left atrium, and you put your probe here, see where I'm coming out from? That's another vein. Got it? You don't have to put your finger. You can put the probe and it will take you right away to where the veins are getting in. Okay? Now, if you go further down from this side and you go all the way up, and you need to confirm that this is the aorta, you try to connect these two people together, okay? And you will find that whenever you go this way, nothing is going to stop you. Why? Because you're opening up the valve. So if you go from here all the way up, look how the probe came out in a split second. Yes? Whereas if you try to go from here to there, it will be held. See? It is held by the valve, by the aortic valve. Got it? Because this is the direction of blood. It has to go this way. Same thing, if I try to put my finger here, I see that the aortic valve is holding me from going any further. But if I go like so, here is my finger right away coming out in a split second. Got it? Okay. Now we're done with the right side of the heart, with the left side of the heart rather. Here's the right side of the heart. We're going to make a section here and look at the difference. See how thin this is compared to this? It's like 3 times as thick. Okay? And when you get there, you're going to see a smaller chamber, and you come out of this chamber through the pulmonary artery. Technically, it's the pulmonary trunk. But you see that you can come very easily out of this. Why? Because this is the same direction of the valve. Alright? You try to come back, or to go back in from here, okay, from the opening, and your probe will be held by the valve leaflets, okay? Because technically, you're pushing them together in the middle. But when you go like this with your pinky or the probe, it will come out right away. Alright? Because this is where the direction of blood is. You are going to open up the valve. See how simple it came out, right? So, this is the right ventricle, okay? This is the pulmonary trunk. Trunk, by definition, is a small vessel. As soon as it comes out, splits into right and left, okay? So that's why we don't say that this is a pulmonary artery. It's a trunk, okay? Because it separates into right and left pulmonary arteries. Remember, goes away, artery, okay? Goes versus vein, all right? And you know the difference in the structure here. Got it? Now we are in the right side of the heart. We're going to make another cross, okay? And we're going to put our finger here, the small one or the probe, whichever. And you are going to see that it goes right away. Don't make this boo-boo like I made it here. Don't come out from the right side of the auricle. What did you get into? Nothing, all right? So you need to go into the cavity like so. And you can see it goes boom, right away. Okay? Went through without any resistance because I'm going towards the direction of, or with the direction of the blood. Okay? Whereas if I try to come out from this side, I will be held, and I am held already by the valves of the tricuspid valve, which will close and prevent my finger and the blood from going back where it came from. Okay? Can do the same thing with the probe. You go with the probe like so. It comes out immediately. Try to come up with the probe. It would not go anywhere. The valve leaflets will close on you, prevent you from going back. With your same fingers that went through the atrium, I'm going to flip it 360 degrees and come out from where the superior vena cava is supposed to be. So here is the superior vena cava, and as you can see how thin this is, and it comes out as the inferior vena cava right there. Okay? See how thin the wall is of the vein compared to arteries? And remember, it's the posterior surface. Okay? Now the coronary arteries coronate the heart as so. Like so. Okay? So this is the corona of the heart. So whenever you make a cut anywhere through this, except near the valves, you will see the coronary arteries. So if you make a cut here, technically here are the coronary arteries. See this? You see this? See those openings here? Okay? You see those openings here? You see this here? Okay? These are the coronary arteries. I know some of you don't believe me, but if you look closer, you will see that this can continue and go here and come out of this vein, of this artery. Isn't this the anterior left descending coronary artery. So this goes, makes a little angle here. This is what we call the widow maker. That one, when it's clogged, when it's closed, causes massive heart attack and death. Okay? And unfortunately, makes a lot of ladies widows when their husbands get into that clogging of this. Why? This supplies the whole left ventricle with blood. So if the left ventricle doesn't pump blood, you don't have a systolic blood pressure, the heart will stop immediately. Okay? And where do the coronary arteries come? As soon as the aorta comes out of the left ventricle, it gives the branches of the aorta. It's hard to see from here. You really have to get into the inside of the aorta, and you will see the first, if you have good eyes, the first branches coming out, and as soon as they come out, they coronate the heart between the atria and the ventricle to give the coronary arteries. One goes anteriorly, and then one goes to the left, and becomes the left. When it goes around, it's called what? Any artery, when it goes around, what is it called? Excellent. Who said that? Beautiful. Thank you. Julianne knows that it's called a circumflex. Okay? So it makes a circumflex, goes around, and becomes the descending right or posterior coronary artery, which technically is in the interventricular sulcus, okay, that is across from the anterior interventricular sulcus. So why is the name entitled to you to know that in this position here you have the interventricular sulcus, which is the separation between the right and the left ventricle. So don't ever cut here, because you're going to keep cutting in flesh all the way until you come out from this side and you're still in muscles. But when you cut next to them, you're getting into the cavity of each ventricle. Make sense? Yes? Okay? That's all you need to know. So whenever you cut here, remember, okay, you're going to see the cross-section of the coronary arteries all around. Whenever you cut next to a valve, when the valve gives you the artery, okay, there is a thick ring, okay, made of fibrous tissue. So if you look closer, you will see that the ring is right here. You see, this is a cross-section of the ring. This is fibrous tissue. There's no muscle here. This is where the cups of the valves are being attached around the ring. One from here, one from there, and one from here, okay? And the blood goes here, opens them up, okay? The blood tries to come back. They will be all filled with blood. All three of them, boom, shut, give you the heart sound, okay? AV valves between the atria and the ventricles, when they shut down, give you S1, which is lub, okay? Long and loud, lub, okay? The valves between in the aorta and in the pulmonary, okay, give you the dup, okay? So lub, dup, lub, dup, lub, dup, okay? Short and high-pitched. Capiche? Piece of cake. So easy, yes? All right. Now, whoever has a tray, follow me, please. You can